Once you've chosen the type of movement you most enjoy, you'll want to talk with your doctor or diabetes educator to determine the frequency, intensity, and duration of activity that's appropriate for you. In the meantime, here are a few general rules of thumb. Ideally, you should work up to doing some form of activity 5 or more days a week. The American Diabetes Association, or ADA, recommends 150 minutes of activity a week and suggests that type 2 patients do resistance training 3 times a week. Be realistic about the length of time you can do an activity. Start with 5 or 10 minutes and work up to 30 minutes or more with medical approval. Find the easiest way to fit activity into your schedule. 3 10-minute sessions throughout the day are as good as a single 30-minute session and can be much more convenient. Because physical activity affects your blood glucose levels, it's important to monitor your blood glucose both before and after you exercise. If you're doing a strenuous activity like running, aerobics, or playing a sport, you may also need to stop partway through your activity and check your blood glucose. The ADA recommends eating something if your blood glucose levels fall below 100. Ask your healthcare provider or diabetes educator when to check for ketones. If you have ketones, do not exercise. If your blood glucose is low before you start an activity session, don't begin your activity until you've had a snack and made sure that your blood glucose levels are back to normal. You may also need to work with your doctor or diabetes educator to adjust your medication before you start your activity plan. And finally, if you ever start to feel funny while you're exercising, always stop and check your blood glucose.